MobileMed was created to provide healthcare access for all, with quality services delivered with compassion, respect, and cultural competence to people in need. As our region has become more diverse in terms of income as well as race and ethnicity, the need for culturally sensitive, accessible care is greater than ever. Our dedicated, multilingual staff, along with effective outreach through multicultural community partnerships, make it possible for uninsured and underinsured residents to get their care. Through MobileMed, physicians and others can volunteer their services, and hospitals can provide critical support for the benefit of the entire community. MobileMed creates a primary care medical home for disadvantaged patients regardless of their insurance status. Many have gone without health care for years or have relied on the emergency room. Often they have multiple chronic diseases that can only be managed effectively with regular care. Our walk-in and appointment clinics are available on mobile medical vans and at several fixed sites, all accessible by public transit. Our program development initiatives align with the needs of our population. For example, we've integrated behavioral health within our primary care model since many of our patients have depression or anxiety that impacts their physical health. We also maximize use of our new electronic health record system to identify shortcomings. It's among our goals to obtain status as a federally qualified health center, which would mean the addition of dental services for our patients and health care for children of all ages. One of our keys to success is using innovative, widespread collaborations with community partners to optimize outreach and treatment for hard-to-reach populations. A second key is our hybrid clinical staffing model that combines talented, committed volunteers with dedicated employees to deliver multilingual, culturally sensitive services for more people than we could otherwise serve. One key to MobileMed's effectiveness is our tradition of robust community partnerships. We collaborate across a range of organizations, faith-based, ethnic social service agencies, local hospitals and physician groups, community rec centers, and others. Some of these partners schedule our patients for appointments in their own languages. Others provide free diagnostic testing, and still others give us waiting room space and locations for our mobile vans to visit weekly. The dedication of our staff and volunteer clinicians, combined with our model of using nurse coordinators at each of our clinics, also contributes to the effectiveness of MobileMed. This commitment drives us to arrange for follow-up resources and provide case management, essential elements to maintaining a patient's well-being. We track success in terms of volume, the patient experience, and clinical outcomes. Surveys indicate that 99% of our patients would recommend MobileMed to others. Our preventive screening rates, for instance Pap smears, continue to improve, and we want to compare ourselves to the best private practices. Our clinical indicators such as blood pressure help us track how well our patients are managing their hypertension, diabetes, and other chronic diseases. We also utilize evidence-based assessment tools for depression and anxiety. Much of our program development is designed to impact all such metrics. For example, an innovative endocrinology partnership has measurably reduced the average hemoglobin A1C indicator for our most difficult diabetes patients. Based on our name, some people assume that we deliver only episodic care through our vans. They're surprised that we serve as a true medical home in regular brick-and-mortar clinics. Second, there's limited awareness of the true diversity of our patient population. And lastly, many people don't realize how truly grateful our patients are. Some of them give back through volunteering. And you'd be surprised how many arrive with homemade snacks or other small gifts to show their appreciation. Mobile Med is the most diverse primary care clinic in our county. We serve nearly 6,000 patients annually, helping to reduce reliance on emergency rooms. Through our hospital partnerships, hundreds of disadvantaged ER patients get connected to us for regular primary care. Establishing integrated behavioral health on site within our clinics enhances our patients' health with a safe, non threatening approach to treatment. We're proud that how we integrate multilingual behavioral health into primary care is a model for replication. When Mobile Med faced county funding cutbacks due to the economic downturn, we streamlined our operations to serve the locations with the greatest needs and added to our volunteer clinician base. During economic challenges, the demand for our services only goes up, even as resources are stretched. MobileMed's culture of creativity, adaptability, and resource stewardship has served us well to deliver optimal services at minimal expense. Our tradition is to identify and serve the greatest unmet health needs in the county. With sufficient funding, we would open a new clinic in Aspen Hill, recently designated a medically underserved area by the federal government, expand our services to children of all ages, and provide much needed dental services. There is tremendous need among the uninsured for dental services, which can have a huge impact on overall health. Poor oral health is linked to heart disease, stroke, diabetes, premature birth, and low birth weight. It's a real challenge to develop a financially sustainable program, avoiding high prices or long waiting lists that are the norm. Due to those barriers, most low-income uninsured individuals don't receive restorative services or preventive cleaning and screening. Early dental care, such as filling cavities, can prevent minor problems from turning into serious health issues that are more expensive to treat.